that we study about the distribution and the determinants of health-related states and events in a population or a group of people. So in epidemiology, we don't just learn about the disease, but we learn about the distribution and determinants of health-related states or events in a group of population, not in individual person, but we learn in a population about the distribution and the determinants of health-related states, and how we can apply what we already study in terms of the distribution and determinants of health-related state in a group of people, how we can apply that knowledge into a program that can prevent or control the health problems in a community. That's epidemiology means. So in epidemiology, we learn in a group population, we learn about the distribution and determinants of health-related state of events in a group of people, and then we use our knowledge about epidemiology to make a program aiming to prevent and control health problems in a community. So as I have said before, epidemiology, we learn about this distribution, determinants, and determinants of about health-related disease or health-related events. So it means when we learn about distribution, we will learn about the frequency and pattern of a disease or a health-related events. So frequency, we learn about the number. We learn how to calculate the number of health-related events that occur in a group of people. Or even we can also compare or make a relation between the number of cases into the size of the population, that frequency. So we calculate how many diseases, how many health-related events occur in a group of people, that frequency. And then in addition to frequency, in distribution, we also learn about pattern. So after we know about how many diseases or how many health-related events occur in a group of people, then we learn about the distribution, how those diseases or how those health-related events distributed in a group of people, in a community. It can be by time, it can be by place, it can be by person. So for example, in frequency, if we talk about frequency, for example, we say the prevalence of dental caries is 75%. That frequency is epidemiology. The prevalence of COVID-19, people infected by COVID-19 is 80%, for example. That's also frequency. We learn about the prevalence, we learn about the frequency in epidemiology. And then sometimes we also say that men is more likely to have a particular disease than women. That's the pattern. We talk about the pattern. So we learn about that in epidemiology. So when we learn about the pattern, about how the number of disease or health-related events are distributed in a group of people or community, we learn about the pattern. It can be based off time, it can be based off place, it can be based off personal characteristic. Time patterns, for example, we would like to know about the pattern of particular disease or health-related events annually, or seasonally, or daily, or hourly, or weekly. Is time patterned. So when we say the prevalence or distribution or the frequency of people infected by COVID-19 virus, for example, in a week is maybe 1,000 people. Its distribution by time pattern. Place pattern, if we try to make a distribution of the disease of a particular health-related events by geographic variation, for example, or urban or rural differences and location, work sites, or schools. For example, we can say if people in rural area are more likely to have this disease than people in urban area. That's a distribution of that disease by place patterns. So it's distribution. Or these diseases are more likely to occur in people age 17 years old, for example, than people younger than 17 years old. It's also pattern by personal characteristic. So in epidemiology, first we can learn about the distribution, and when we learn about the distribution, we can learn about the frequency and also distribution. Frequency, when we learn to calculate how many diseases, how many people having a particular disease or health-related events in a group of people or community, and then distribution, we learn about how the number of disease, that number of disease are distributed in a group of people or community. It can be based time, place, or personal characteristic. Okay, that's the distribution. Then in addition to distribution, in epidemiology, we also learn about determinants. Determinants is factors influencing the occurrence of a particular disease or health-related events. So what factors influence the occurrence of a particular disease or health-related events? That's determinants. Because in epidemiology, in dental public health or in a public health, we believe that a disease or illness doesn't occur randomly in a population. So people, when they got sick, it's not because they got a disease by chance. No, because the disease will not happen randomly. So we believe that there will be several risk factors in a particular person, and it's accumulated, the risk factors are accumulated, and then the disease occur. So that's what we believe in public health. So there will be factors influencing the occurrence of a particular disease or health-related event. That determinants. So determinants, we learn about the cause of a particular disease or health-related events, or we learn about factors influencing the occurrence of disease or health-related events, or usually we say it as risk factors. When we learn about risk factors, it can be modifiable risk factors or unmodifiable risk factors. Modifiable risk factors, it's risk factors that we can modify, we can intervene, we can change the risk factors so we can prevent the occurrence of a disease. However, in unmodifiable risk factors, it means that the risk factors we cannot change. It's fixed. For example, for modifiable risk factors, the risk factors which we can intervene, we can change the factors so we can prevent the occurrence of the disease, or we can prevent the disease. So for example, behaviors. So for example, if lung cancer or periodontal disease is caused by smoking, smoking is modifiable risk factors of lung cancer or periodontitis or periodontal disease. Okay, so smoking is modifiable risk factors. Why it's a modifiable risk factors? Because we can change smoking behaviors. We can intervene people and make them to stop smoking. It's behavior. We can change behavior. However, if the disease is caused by, for example, by genetic or by age or by gender, the risk factor is because of gender, because of age, because of genetic. It's hard for us to change. We cannot change anything. It's non-modifiable risk factors. So it's determinants. So in determinants, we learn about the factors influencing the occurrence of a particular disease or health-related events. And this is the example. For example, dental caries. People who have dental caries is not because they have dental caries because they get dental caries by chance, or it randomly occur in people, but there is like the cause of dental caries. There is like the risk factors of having dental caries. The cause of dental caries, of course, because of bacteria, Streptococcus mutans. Okay. However, there are a lot of risk factors that can increase the likelihood of the bacteria to make or to cause dental caries. Everyone has Streptococcus mutans in their mouth, okay? However, sometimes if we have risk factors that can increase the ability or the chance or the opportunity of this bacteria to make dental caries, that's determinants. For example, here's the risk factors. It can be like the condition, the oral condition. If we have malocclusion condition, if we have a crowded teeth, it will increase the risk of us to having dental caries, because like crowded teeth, we cannot clean our teeth properly. So there will be like food stuck in our teeth for a long time, and it will cause or it will increase the rate of having dental caries because of acidity. And then there is like a demineralization. We will lose minerals in our teeth, and it will become a dental caries after that. So that's determinants. And then that's what we learn in epidemiology. So we learn, our focus is learning frequency, distribution, and also determinant. Distribution, we learn about the frequency and this distribution, the pattern, and then also we learn about determinant or factors influencing the occurrence of a particular disease or health-related events. And then another keywords of the definition of epidemiology is health-related events. So basically, originally when the expert found the term of epidemiology, it's only for communicable disease or infectious disease. However, now epidemiology is also used to learn about any other disease or health-related events. It's not only just about infectious disease, but also we can learn about non-communicable disease, chronic disease, behaviors, and so on using epidemiology. As long as we would like to learn about the frequency, about the pattern, about the determinants, we can learn anything using epidemiology. We can apply epidemiology in any of topic or any circumstances or conditions. And then the scope. In definition of epidemiology, the study of distribution and determinant of health-related events in a population. So a population is also the keyword or the scope of epidemiology. In epidemiology, we don't learn disease or health-related events in individual person. However, we learn epidemiology for a group of people, for a community, for population, in a particular location. For example, East Java people is population, children in Surabaya is population, factory worker, school children, hospital patients, dental students, it's also population. So epidemiology we learn in a group of people, or we name it as a population. And then in epidemiology, we have two types of epidemiology study. We have descriptive epidemiology, and also we have analytical epidemiology. What's the difference between descriptive and analytical epidemiology? Descriptive epidemiology, when we only observe the frequency and the pattern of a disease or health-related events. We only observe. We only want to know about the frequency and the pattern of a disease or health-related events. For example, in descriptive epidemiology, we only would like to know the prevalence of the disease, the frequency of a disease, the distribution of a disease. If we would like to know, for example, about the prevalence of dental caries at 75%, it's descriptive epidemiology. If we would like to know which one is more, which one to have a higher risk of having dental caries, boys or girls. It's also descriptive epidemiology. So in descriptive epidemiology, we only try to observe and find out about the frequency, the distribution, and determine the distribution and the frequency on the pattern of a disease or health-related events. That's descriptive epidemiology. However, in analytical epidemiology, we will try to link or make a relationship about the disease and the cause of the disease, or the disease with the cause, the risk factors of the disease. For example, in analytical epidemiology, we will have like a specific hypothesis. For example, eating candy can cause dental caries. There is a relationship between a high consumption of sugar and dental caries. So it's our hypothesis. And then in analytical epidemiology, we would like to test whether our hypothesis is correct or incorrect. It's analytical epidemiology. So in descriptive epidemiology, we only observe to know the prevalence, the frequency, the pattern of the disease. However, in analytical epidemiology, we would like to make sure whether there is a relationship between these risk factors and the occurrence of a disease. So in analytical epidemiology, we definitely need a specific hypothesis to test in the study. Because at the end of the study, we will find an answer whether there is or not these risk factors cause a particular disease, whether or not high consumption of sugar can cause or can increase the risk of having dental caries. Is analytical epidemiology. So we learned about the risk factors or exposure and how these risk factors have a relationship with a particular disease. Okay. However, in descriptive epidemiology, at the end of the study, we only have an answer about the frequency of a disease, the prevalence of a disease, or the pattern of the disease. We don't have a purpose to find out the association between the exposure or the risk factors and the respective diseases. That's the difference between two types of epidemiological study. And then about public health. So we have a lot of definition of public health. However, if I would like to sum up about the definition of public health means that it's many efforts organized by a group of people or community aiming to protect and promote health, or also restore the health of people. That's public health. So public health is many efforts organized by a group of people, and the aim of those efforts is to protect health, to promote or maintain health, and also restore the health of the people. That's a public health. So before we discuss about the epidemiology, it's a study of something, okay? It's study that we can apply to any circumstances, any condition, any disease or health-related events. It's epidemiology. And then public health, we do or we carry out epidemiological study. So epidemiological study usually is carried out by public health practitioners. So when you work in a hospital, when you work in health department, in health community health centers, and in other places, you will also learn about epidemiology. And in public health, when we do epidemiological study, epidemiology is one of the core discipline in public health. Usually when we work as a public health practitioner, when we study about epidemiology or other public health disciplines, we usually need a collaboration with other in the professionals. So we cannot work alone. We need to work together with other professionals. Sometimes we don't only work with other health professionals, but also we need to work together with other professionals, including like economics, politicians, a policymaker, and so on. So we work together with other professionals in public health and also in epidemiological study. Now, we have talked about epidemiology, and epidemiology is one of the core disciplines of public health, and we should know about the definition of health. So before, we always define health as the absence of a disease. This is this is like the absence of some things, or the absence of the function of our body, okay, or our psychological condition. And we usually define health as the absence of a disease. However, in fact, the World Health Organization define health is not only the absence of the disease, but in order to be able to healthy, we need to have like a good physical, mental, and social well-being. So the health is not only about a physical condition, but also we need social and also psychological health condition to be healthy. And some terms we usually use in health: epidemic, when the disease occur in several region or location in one country. And then if the disease occur in several countries or involve several countries, we say it as a pandemic. And endemic, when a disease occur in a specific or a particular location, it's isolated in a particular location, is endemic. Okay, epidemic, pandemic, endemic. Epidemic, when the occurrence of a disease, the number of disease is excess the normal condition. Pandemic, when it involves several countries. And endemic, it happens if the disease occur in a particular location. For example, in COVID-19 before, in Wuhan, China, before COVID only happened in several region, in several location in Wuhan city. It's still epidemic. And then it spread out and it involves several countries and it becomes pandemic. And then now, COVID is only happen in in a particular location. Or for example, malaria happens more likely happens in Papua. It's also endemic disease. So endemic disease is a disease happens in only in a particular location. And then illness is what the patient experience when the patient feels sick. It's illness. And sickness, if the disease has an effect in a patient social life. That's sickness. So that's like the difference between illness and sickness. And disease is when the health practitioners diagnose this patient as having a particular disease, that disease. But illness is only like the perception of the patient. If still the patient feel like uncomfortable, feel like they have a disease, but the health practitioner haven't given the diagnosis for this patient, is still illness. Sickness, if the disease has an impact on the patient's social life. And now what can we use epidemiology, the benefit of learning epidemiology? First, if we learn or study epidemiology, first we can describe the health status of population. So in COVID-19 era, if we don't use or we don't study epidemiology, we will not know about the trend of the COVID-19 in Indonesia. We will not know how to prevent or how to solve the COVID-19 in Indonesia, because we need the trend of the COVID-19. We need to learn about the cause, the risk factors, the mode of transmission of COVID-19. Then we can create programs to prevent the disease. So first, by using epidemiology, we can describe the health status of population, including the trend of the disease. We can know about the burden of a disease in a population and the mode of transmission, how this disease is transmitted from one person to another person. We can describe it in using the epidemiological study. We can also identify the pattern of the disease, so we can be aware of the pattern, and we can make programs that can prevent the occurrence of the disease. And second, in epidemiological study, we can learn about the causation. What caused the disease? What is the primary agent of the disease? What is the characteristic of the disease? So what are the risk factors or the contributing factors of the disease? We can learn about the causation, and then we hope that by learning using epidemiological study, we can make an efforts to prevent the factors influencing of the disease or the primary agent of the disease. We can know how to cut the ties between the primary agent and the disease. The third, we can use epidemiological study to learn about the natural history of the disease, the natural course of the disease, how the disease happens from the start, from the virus get into our body, and until we feel the symptoms, until the disease appears, until it's recovered without the medication. So it's natural history. We can learn how the disease happens. And then planning programs. As I have said before, if we can learn about the distribution, the pattern, the frequency, the determinant of a disease, we can make up programs aiming to prevent the occurrence of the disease, aiming to intervene people who already suffer from the disease. So this is the summary of the aims of epidemiological study. First, we can find out the etiology or the cause of a disease, and then we can also learn about the burden of the disease, the extent of disease occurrences, and we can learn about the natural history of disease. We can assess the therapeutic intervention and policy, and we can also identify or create a programs to intervene to change modifiable risk factors. This is what I have said before. So in epidemiology, after learning the epidemiological study, we know about the determinants and also the distribution of the disease, and we can apply our knowledge in this disease to plan a programs aiming to make a treatment and prevention of the disease. So this is some example of epidemiology concern to tackle or to solve the problem of particular health related events or disease. For example, they did a study of the effect of environmental and industrial hazards, maternal and child health, food safety and nutrition, and etc. So until now, there are a lot of epidemiological study have been carried out to solve the problems in terms of disease or health-related events. Because after we did epidemiological studies, sometimes the result of our study will have an influence or will be used by our government, our politician, our health policy makers, our financial departments to make a programs to solve this problem. For example, stunting, the condition of our nutrition issue in Indonesia, how we can make a program for preventing or solve the problem of stunting is start with epidemiological study. And now we move to oral epidemiology. We will focus on oral epidemiology because we are in dentistry field of study. So it's the same as general epidemiology. Oral epidemiology, it's also epidemiology, but with it only focus in oral condition. So in oral health, we can say oral health, or we can define oral health if it's free from any condition or any disease that can affect or can influence the function of our mouth and oral cavity. So it can range from, it's free from chronic mouth and facial pain, or oral and throat cancer, oral sores, birth defects, for example, cleft lip and palate, periodontal disease, tooth decay, and so on. So it should be free from any condition or any diseases that can influence the function of our mouth and oral cavity. So in epidemiology, if we say oral epidemiology, we study about the distribution and determinants of oral health related state or events in a group of people or population, and we apply our knowledge to control or to prevent the occurrence of oral health problems. So the definition is the same as the broad definition of epidemiology, but we only focus on oral health. Okay. And in oral epidemiology, in other sub-discipline of epidemiology, usually they use the disease to name the epidemiology. For example, the epidemiology of lung cancer, the epidemiology of chronic disease, infectious disease, cancer epidemiology, reproductive epidemiology, and so on. So usually they use the name of the disease to name the epidemiology, to name the sub-discipline of epidemiology. However, oral epidemiology is the only sub-discipline of epidemiology that use an anatomic section of our body to name the sub-discipline of epidemiology. Oral epidemiology. Oral is the anatomic section of our body, and we use this name to name the sub-discipline of epidemiology. It's different from other sub-discipline of epidemiology that usually use the name of the disease to name the sub-discipline of epidemiology. Okay. And then okay, as I have said before as well, in oral epidemiology, we also learned about oral health in a group of people. We learn about the distribution and determinant of oral health related events in a group of people, but we work together with other professionals. We work together with both health and non-health professionals that can relate to the occurrence of oral health-related events. It influenced the orofacial region. So we work together with other professionals to study about oral epidemiology. And there's a difference between epidemiology, clinical medicine, and basic science. So in epidemiology, we learn in a group of people. Clinical medicine, they learn in individual people or individual patients. That's the basic difference between epidemiology and clinical medicine. Epidemiology also learn about how the disease mechanism or the occurrence of the disease in a population level. Basic science learn about the occurrence of a disease in an individual person. They learn about the mechanism, they learn about the occurrence of the disease in the individual body. However, in epidemiology, we learn the mechanism, we learn the occurrence of disease in population people, in a group of people. So if we would like to prevent a disease, basic science and clinical medicine will focus on individual person, how we can prevent the disease in individual person. However, in epidemiology, we will think about how we can prevent the disease in a population level, how we can prevent the transmission of a disease in a population level. That's epidemiology too. An analogy, efficacy and effectiveness of a vaccine, for example. In clinical medicine and also basic science, they only learned or do a research about efficacy for individual person or individual patient under experimental condition. And they can say after they do like an experiment, and they can say, okay, this vaccine is have efficacy, high efficacy in individual person under experimental condition. However, when this vaccine are distributed in a population level, it can be non-effective. Why? Because there is a lot of characteristics that can influence the efficacy of the vaccine. For example, maybe because there's like a bad side effect of the vaccine because of a high dose that make the people feel uncomfortable, so that they would like or they refuse to have the vaccine and so on. So when the clinical medicine and then the basic science say yes, it may be epidemiological practitioners say no, because we think about how it can be used, how it can be effective in the population level. If it can only effective in an individual person, it doesn't mean in a population level it will be effective, because there are a lot of factors influencing the use or the compliance of people to use such medicine or vaccines. Another example is like the immunity. In epidemiology, we learn or we think about herd immunity. So we need to make most people immune first, and then we can prevent the occurrence of a disease or prevent the disease to be occur in a population. So in summary, in epidemiological study, we will focus on a group of people in a community, in a population, rather than individual person, individual patient. But in clinical medicine, basic science, they will focus on individual person or individual patients. That's the main difference between epidemiology, clinical medicine, and basic science. So in epidemiology, if we learn epidemiology, you need to learn in a population, in a group of people or community. Okay, that's the end of our lecture today. Is there any questions about epidemiology, the introduction of epidemiology?
Doctor, I do have a question.
Yes.
So the population varies according to which group of people that we are, how to say, assessing the particular disease, is it?
Sorry, can you repeat your question?
So just now, earlier you said the population depends on like which group of people we are experimenting it on, right?
Yeah,
Just wanted to clarify that.
yeah, we can determine by ourselves to make a group of people we can study epidemiology. You can only select a one school to study the school children in one school. It can be, we can say it's a population. We can say children in Surabaya as our population as well. So the researcher can determine the population or the scope, the coverage of population in their study. Iswaria. Does it answer your question?
Thank you for clarifying that, Doctor. Yes.
Okay. Any question? Okay. All right. So if you have any question after this lecture, anytime you can just send me a message in my WhatsApp number, and I will try to answer your question. Okay, because it's like a basic knowledge that you should know before you will have like a higher grade later on. You will use this knowledge until you graduate from the faculty of faculty of dental medicine, particularly for dental public health course topics. Okay, thank you, and this will be the end of our lecture today. Assalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you, Doctor.